Good evening, everyone. Welcome to the channel. In tonight's talk, I'm speaking to Louise De Jonge, a physiotherapist based in Cape Town, South Africa. Welcome, Louise.
Hello, thank you. Thank you so much. Hello, everyone.
It's great to have you on the podcast. I know we've met in person in a different context, but we were chatting just informally about some of the health challenges that I've been working through with long COVID. And I was very interested to find out that you were a physiotherapist and you've had some experience with treating chronic pain. And I guess that comes with inflammation as well. I imagine there's various conditions.
Yeah.
I'd love you to introduce yourself and just tell us a bit about your background in physiotherapy.
Yeah. So I have been qualified for 35 years as a physiotherapist, mainly in musculoskeletal injuries. About 3-4 years back, I did a post-degree diploma about chronic pain and management, which is quite something that we haven't been taught in detail in the 80s when I was studying as a physiotherapist. In the old days, you sort of believe that pain is a signal that's actually coming from a body part up, sending it up to your brain, but it's actually not what's happening. What's happening is that it's a stimulation, either then potentially dangerous, or maybe then if one's got an injury like a sprained ankle, or say a sprained ankle, then it sends like a signal to your brain and it's telling your brain there's something wrong down there. And then your brain will sort of evaluate that situation. Have you been there before? Is it dangerous? Is it going to harm you? Do I need to stop you in your tracks? Do you need to see a doctor? And then on that sort of situation at that moment and that time of your life, it will send then down a signal of how much pain you will actually experiencing. So if you do not have a functional brain, that you can't actually really experience pain. So it's quite interesting how your immune system actually also plays an incredible big role in pain, and how much pain you can experience at the time of moment in your life. So that's what and physiotherapy, musculoskeletal pain. I love it.
Incredible. And where is your practice, or the company is the practice you work for?
No, I work in a practice in the south of Cape Town. Yes.
Okay, incredible. And have you guys come across any, I guess, chronic fatigue syndromes or chronic disease or long COVID patients in your practice?
Yes. No, we see that mainly chronic pain patients, and chronic fatigue is quite high on the list. I think before COVID happened, we heard more about sort of fibromyalgia, which is also a disease, and it's, of course, now it's the diagnosis of that is now much more better. Again, like I say, like in the old days, people or patients that's just been sort of ignored if they go to the doctor and they say, I'm tired and my body is sore, and and then that sort of patient will, with chronic pain, unexplained chronic pain, usually are ending up running from doctor to doctor, from physio to physio, trying to find a solution for their pain and how to manage it. But luckily, with the new research and everything that's out there, there's much more strategies and treatments now available for managing pain. And now, of course, we've got names for things. And of course, now after COVID, we get that there is definitely association with some patients. It's not a big percentage, but we do see them as well coming along, complaining.
If I came to your practice out of interest, what would you recommend to someone like myself who's struggling, I guess, with vascular inflammation? There's endotheliitis, other factors like that I'm still trying to figure out. I know there's microclotting in the blood, and what would you say to someone like myself to start, I guess?
Yes, I think for us as in physiotherapy, because our patients can walk out from the street into our practices, that we don't necessarily have a medical sort of report like blood tests or anything. So what we usually do, we will have a full assessment. subjectively, you will ask your patient about symptoms and about pain at night. And then there's a numerous tests, active tests objectively that we will look at. For pain specifically, there is also like questionnaires that we can use for them. Yeah, so first of all, we need to assess, and then we need to find, when is the pain the most? Is it at night? Is it at day? Is it just coming after exercise? It just happens. You don't have an association with any incident. So those things plays a role. And then managing, I think also when we teach people to manage pain, one of the techniques is to tell them is not to fear pain, and that pain is not just always bad. It's part of life, keeps us alive, and it obviously tells you something is wrong, or it can tell you. We also can get pain with patients that's got high depression levels, lack of sleep, severe trauma in younger life, that can also present as a pain symptom. But then the management usually is then like sort of mindfulness is some of it, deep breathing exercises, pacing yourself, pacing your life, because you can't like say, okay, I want to exercise, but I have a lot of pain. And then the day you don't have pain, you go crazy, and then you're out of it for 2 weeks, and then you feel better, and then you go crazy, and then you're out of it again. So you also like then stimulating your pain cycle to increase. So so assessment is one of the big things, and then from the look at sort of things like what I've just mentioned in managing pain, and what you can do as a person. Lifestyle, of course, lifestyle changes, adapting to stress, and sleep hygiene. Sleeping is very important as well in chronic pain. Proper sleep, not just sleep, snooze, sleep, snooze, sleep.
Incredible.
Is that answer? Yeah.
Yeah. So I was actually interested to ask you. I came across a concept called the polyvagal theory in my research, and I guess exploring different long COVID treatments. And this theory basically says that I think it's your parasympathetic nervous system is overactive, it's overstimulated, and there's the thought that if we can calm that down, it'll stop your immune response and a lot of the symptoms that a lot of long haulers and I guess vaccine injuries as well, potentially, ME/CFS potentially as well. But in terms of that, could you tell us a bit about the vagus nerve and why that is important? Yeah, to someone who's very new to it, it seems like a bit of an out there approach. Like it's like, oh, think your way to be better, and just do a few breathing techniques, during the day, and you'll magically get better. But I'm sure there's a lot more to it than that.
Yeah, so your vagus nerve is it's what we talk about cranial nerves. It's a tense cranial nerve, and it's the longest one. So it actually comes out of your brain stem. So it's quite high up here under your skull. And it runs like deep, just like next to your carotid artery, behind, down into your chest. And then of course that's why breathing it works. It's like because it goes through your diaphragm. So if you breathe and you do high, like deep, proper diaphragmatic breathing, it sort of stimulates the vagus nerve. But when this vagus nerve is stimulated, it lowers your heart rate, and it actually lowers your blood pressure, and it lowers like symptoms like, like anxiety and stress and these things. So that's how they work with that. Yeah. I know, I can't remember the detail, but I know they do an implant like directly into the vagus nerve, quite high up in the neck, that there's a little bit of a stimulator that they can do with the chronic pain patients. And then of course, like you say, with the TENS machines, that you can, it's difficult to get it, but it is either. So I did say to you the other day, why don't you just put it on your diaphragm, then you can really reach it. But the other way, with TENS, when you just go really high up here in your ear, behind your ear, and then high up in your neck, then you sort of can get it as well. But I think it's also, I think breathing is also really a more effective than what we think about getting that vagus nerve to calm down, because it like I say, it controls your heart rate, it controls your digestion, like your respiratory rate, and like you say, it influences your parasympathetic system.
So the listeners, for context, Louise is Afrikaans.
Very much.
So I appreciate you speaking English, which is not probably your first language with us. And in terms, just for someone who doesn't know what TENS is, I didn't know about what it was about 3 weeks ago. I've only just learned the term. Could you explain a bit about that? Yeah.
Yes, it's shortened for like transcutaneous electrical nerve stimulator. It's like a low voltage electrical current, to relieve pain, and it literally sort of puts sort of a sense of when it's on your body, it gives like little pulses, and of course your nerves is picking that pulse up. And then we've got in our pain theory, we've got something called our gate control theory, which is quite interesting. Like this they also taught us in the 80s, like some of our techniques, when you do like big movements, it sort of blocks the pain impulse coming down, because your brain has now got to focus on this bigger movements. And so it's quite interesting. And then you get also that endorphin release, which help to with pain control and lowers the pain. And you can actually, if you got pain anywhere in your body, say for instance your knee is paining, you can actually put it on your back or on other areas of your body, because it's more about just having that stimulation that triggers the release of endorphins and help with pain control. And it's a safe little thing to use. I mean, you can stick it on and it's safe and it can't harm you. It's not like taking loads and loads of pain medication, So TENS is very, very safe to use for us,
Amazing. I can show you the unit I got. It's this little Bureau unit. I think it's Bureau. I think it's a German brand. And for the listeners who've never seen one of these before, you basically have these little pads, and you peel this off, and then there's a little sticky layer, and then that'll stick to your skin. So I guess it's more ideal just to use yourself. You don't want to be sticking it on your family members and back on yourself and things. But that's the unit, and it's got 4 pads, and then it plugs in USB-C. So just to go back to your thoughts on where would be good spots for treating vagal nerve stimulation, if we don't have 10,000, 15,000 rand for one of these specific vagal nerve stimulators, we could try, you said, just upper neck, just below the ear.
Yeah, just like really high up there, and then you can just put it also a little bit down on the muscular area, the second pair. If you use either 4 or so
together.
So you can use 4 or just the 2. That
and then
will be.
You also said diaphragm, so just under your chest here.
So I was like lower down. There's no evidence for that one though. But
okay. But I'll give it a try, and I can give you feedback if it helped me at all.
So let's see. We can always do a new clinical trial.
Incredible. It's something I've just started. I've only been doing it for about a week. I can say I've noticed my inflammation pain seems less. But I'm also cautious to say this definitely works, because it could also be placebo. I'm actually going to give it a couple of months and then do a video on it and say, okay, cool, this helped me. Doesn't mean it's going to help everyone. But for myself, like this, in South African terms, this is 1,500 rand about, which I guess is about $75. And the downside is obviously maybe it's not the specific vagal nerve stimulation technology, but unfortunately those devices are incredibly expensive. They 5,000-6,000 rand up, for those wanting to get into it, I think this seems like a good option as far as I can tell. Yeah.
And I think also, Chris, something that you might also find interesting is like, for managing pain, you must also now remember, we know you've got pain because you've got that chronic triggers, danger signals that's going to your brain, telling you something is wrong in my body. Now, um, you can also treat your middle back, your thoracic spine. So I would like you to try also to put it in your middle back, 4 or 6 electrodes. Sometimes it comes with more, just to sort of play around with it, because you can also influence your autonomic system
Yes.
through
Yeah.
your middle back, the neck, middle back, and
Mm.
lower back. But the middle back, there is also some evidence for pain control there, like treating that area
Incredible. Yeah.
specifically. And then you mentioned something about placebo. Now I want you to know that we also, in pain management, it's wonderful to tap into placebo. If
Okay.
we can get, so now you
Yeah.
must, this is
Yeah.
very interesting that they've had done some studies, and yes, I might be wrong with my numbers in exact numbers, but as I recall, that when they've done some trials, that some patients, there was a 20% placebo effect with some of their tests they done. Say, for instance, someone puts on a white jacket and someone looks like just a nurse, and the nurse gives the patient like the real medicine, and the doctor goes there and they give them like Smarties. The patient that saw the doctor treating him actually got also pain relief. And so that's sort of studies that they do, and that 20% placebo effect is something we can use. So if you can already get pain relief 20% just by placebo effect, why not?
I suppose a lot is in the mind.
Uh-uh,
Yeah. I,
pain, nothing is in the mind. It's you've got a brain, it's an organ, it's full of
Mm.
currents. It's an amazing organ that keeps you alive and keeps your body in harmony.
Mm.
Uh,
I think in
yeah.
yeah in Western medicine, or just in medicine growing up, I think we assume I have a headache, I take a Panado, I take a pain medication, and that's it's a chemical, it's a drug that fixes it. But I think a lot of this functional health is dealing with different aspects of the body, like your diet, your
Yeah.
gut health, like you said, your pain management,
Yeah.
breathing techniques. There's a lot of I think the point is there's a lot of health that we don't always ascribe to as part of the whole system. We don't think of our body as
Mm,
electrical signals and nerves and everything making it up.
currents.
When I thought
Yeah.
vagal nerve theory, I thought, oh, that sounds very like airy fairy, like why would I try that? But
Yeah.
and then I started to think about, actually my brain and my gut and my whole spine and everything is connected with a nerve, this vagal nerve, and it makes a lot of sense that if you can work on a whole bunch of different things in the body, it should add some benefit, you know.
Yeah.
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 And just in
Yeah.
terms of other ways to treat your chronic pain, what are some methods that you do with patients that come in besides your breathing? You've got I forget the other terms you use, the techniques you said.
Okay, again, so it depends on what the reason is for chronic pain.
Mm-hmm.
Obviously, um, some of our managed technique is, yes, breathing, meditation, mindfulness.
Mm-hmm.
So a distraction is also a fantastic thing to do. It's like when someone is very preoccupied with a very interesting thing, they seem also to get a decrease in their pain.
Mm, mm.
um, and then pacing yourself, because we also exercise also helps to excrete the good hormones like
Wow.
endorphins, for instance, or that stuff
Mm-hmm.
that helps you to feel better, and it lowers your pain. um, and I think, but then again, it's also pacing, because it's also not like, okay, today I'm feeling better, I'm going to clean my room and cook all the meals and catch up all my groceries and go for a walk. And and then the next 2 weeks you can't do it. So
Yeah.
that's not pacing, and that's not pain management. What one should be doing is like, okay, I know I can do a 20-minute brisk walk 4 or 5 times a day, 5 times a week, and I'll 5 times a day can also be
Yeah.
eventually,
Yeah.
and I'll be okay with that. And then you stick to that, even on a day where you don't feel as good. And then the day where you do feel good, you still stick to your 20 minutes. You don't then do an hour.
Yeah.
And that's where we talk about pacing myself, and a gradual introductory sort of thing that you do to yourself, to your body, in saying, okay, I've never walked. I cannot walk 20 minutes. So what can I do? Okay, I can do 10 minutes. Then you do your 10 minutes every day or every second day or so. And again, when you feel wonderful and you feel like that one day, I want to do more. No. You stick to your 10 minutes, and gradually you increase to 12 minutes or to whatever time. So it's always timed. And it comes to SMART goals. You must always time yourself. I never will tell a patient with chronic pain or even chronic fatigue syndrome, any of those, to go and walk 3 kilometers, because 3 kilometers can take that patient an hour, where it can take for someone else again 5 minutes, so that you always got to say it needs to be timed. And so that's the other thing, is pacing yourself. So if we look into it, it's mindfulness, breathing, distraction, exercise in like paced exercise,
In moderation,
good sleep. Good sleep. Always have a good sleep. Those are your big basic things that you can do.
Incredible.
And of course,
thanks, Louise. Sorry. You go.
And physiotherapy wise, we have other stuff as well, like gentle mobilizations or dry needling. Some patients find they find that acupuncture works for them. So it all depends from patient to patient.
So out of interest, that's something that I spoke to a friend recently in the UK, Lexi Borum. She's also someone battling long COVID for a few years now. And she said she's found acupuncture helpful. And I was wanting to know, is acupuncture and dry needling the same thing?
So acupuncture, it's older than dry needling. Acupuncture comes more, it's more going about the energy flow from in the body. So for me, I'm a bit more scientific. So I'm not into that sort of energy flows, and they've got points, the liver point and the kidney point and that. So I'm not into that. But and then and dry needling, we are more. We tend to talk about trigger points or tight nodules, and then if we go into the muscle or the sore spot in the body, we go in with a needle, and the muscle can make a twitch response, and then we take it out. But at the end, as soon as you prick the skin, you are sending a danger signal to the brain immediately. And then immediately your brain's going to respond on that, and it's going to okay, now I need to do something, and it starts excreting growth factors and endorphins and all the stuff that it needs to heal the body. And it's sort of okay, so it immediately it does something. And if you think about it, whether I do dry needling or acupuncture, I'm breaking the skin, so I'm creating a micro damage area there, which is going to trigger a response in your body.
I see.
And which is interesting with pain, the pain research also, they found that we don't have to go in as deep in the muscle. You can just literally break the skin, and it helps also to get it helps with the pain management of the pain. It's got to do with your neurotransmitters that gets excreted. Yes.
Wow.
Which is
incredible.
what you need. No,
so just
wonderful.
to clarify, we're not saying that people should go start stabbing themselves and pricking themselves with pins. Seek a professional like yourself.
Don't.
Yeah.
Yes, it needs to be sterilized, and it needs to be done on the right places, because you can poke your lung or your kidney or
dear.
give yourself a pneumothorax, and you don't want to do that. Yeah, no, it's very specific areas, please.
Mm,
It's under sterilized or clean
mm.
conditions.
I
Well,
was really I guess excited to hear about your autonomic mention of autonomic nervous system, because something that patients with long COVID are struggling with, and I guess ME/CFS, is this dysautonomia is the term, but it can be everything from your heart rate to temperature regulation of your body. You know, I find I sweat a lot more in summer,
sweet
and
glands, yeah.
yeah, and something is wrong in my nervous system, in my autonomic system, I guess, to a point. And yeah, so I'll definitely consider coming to book a session with yourself at your practice, and hopefully try some different treatments. I'm very keen to try the dried needling and acupuncture, something I
Yes,
haven't done yet for long COVID,
yeah.
but I'm trying to uh, do as much as I can and share that on this channel, and with a fellow long haulers and other people that are struggling with chronic
Yes,
disease and pain.
yes.
And yeah, that'll be incredible. In closing, Louise, what would you say to someone to encourage them who's struggling with chronic pain or chronic disease? Yeah.
Yeah, I think one must always believe that it's not the end of the world, and it's not necessarily going to get worse as we get older, because pain is pain. Sometimes pain is 1 out of 10, and sometimes pain is 10 out of 10, and sometimes 15 out of 10. And there's always help, and there's so much new research coming out on a daily basis, which is just incredible how they sort of implement all these new stimulators or um, um, pain management techniques that you can do. And I think it's always good to consult professionals that works in chronic pain, because not everyone is specialized enough in managing that for the patient. And we shouldn't fear pain, because as soon as we start fearing pain, we lower our pain threshold, and then our pain intensity is higher. So there's so much to talk about that as well. But yeah, so it's just by encouraging um, and do sort of the breathing, meditation, mindfulness, light exercises or light stretching, distraction. Do things that you enjoy, rest if you need to rest, but try also not to just rest, also have like a bit of a plan of exercise and progression, and be with family and friends. It is all things that helps us to feel better.
Yeah, yeah. I can share from a personal point of view. When I was struggling with mental health things, it's part of long COVID. There's definitely effects to your chemical balance with
Yeah.
your gut health and a whole bunch of other
Oh
things,
yeah.
inflammation.
Yeah,
But
it does.
in my 20s, before the pandemic, I found when I was down, I just wanted to be alone because I felt almost ashamed of feeling depressed or anxious. But I actually found that the minute I was with a group of people, just with my family and my friends, that actually just like centered me, and
Yes.
I guess made me feel more present, because depression and anxiety
Yes.
can be a lot about past hurts or future
Yeah.
anxieties and things. And
Yeah.
I find that it's those simple things like just seeing some colleagues at work and having a coffee with them, or
Yeah.
seeing my girlfriend for a coffee, and seeing my
Yeah.
family for lunch. Those things are super helpful. Yeah.
Yeah.
Mm.
And then I forgot to mention, there's also stuff that they do in the psychology, is the cognitive behavioral therapy. They
Mm.
teach patients how to manage these sort of things, so which is also very helpful. So like I say, there's loads and loads of things on that research that is coming out. So there's always hope.
Incredible. I'd love to have you back
Yeah.
at some point. Maybe in
Yes.
a couple of months or a year or so, when we've got some, I guess, more
Yes.
evidence and more research into long COVID and
Yeah.
treatments and things. And yeah, thank you so much again for your time,
Yes.
Louise. I really appreciate it.
Welcome, Chris. You're welcome. Thank you so much. Okay.
Dankie,
Bye.
dankie.